I think that, and this is just from my experience of when my family found out that I had HIV, was that HIV scared the Black community so much that it made gay being worse. Because if you were gay, you were going to get AIDS and die, period.
Hi, welcome to Town Hall, a Black queer podcast, a podcast where we journey through a theme by sharing stories, music, poetry, and art of varying depth and hilarity. And today's episode is on the HIV and AIDS epidemic and the aftermath of the AIDS epidemic in America. And of course, there's still an AIDS epidemic going on in different parts of the world and in different communities too. And then, an epidemic in the midst of a pandemic. So there's all, hopefully we're going to get a lot of information today. So my question is, when did you move to New York City?
In the 90s. When did you move to New York City?
2008. 2008.
Gosh.
And was there still, so the year you got to New York City, was there like, what was the status of the aftermath or the midst of the AIDS epidemic while you were in New York City when you got there?
Well, it was the late 90s. I think, for the most part, the sort of, I want to say the commercialization of the AIDS and HIV epidemic uh, and the stigma was starting to shift. It hadn't worn off, and it has probably still hasn't in a way. Definitely hasn't worn off, but like or gone away. But like the stigma, like the urgency of AIDS and HIV, um,
Hmm.
the seeming urgency, like generally, was starting to wane a bit, where people were starting to understand that you can live with HIV. And there are certainly people who, have been diagnosed with AIDS and probably become really, really physically affected, but made it through. And so it wasn't just an automatic death sentence anymore. I think that's what started to sink
Hmm.
in the late 90s. Um, and the commercialization of the notion of AIDS and HIV was like in full effect. I think in the early 80s, we weren't seeing, characters written into stories who had AIDS or HIV. You certainly didn't see people written in who had HIV. It was like, so here's a gay character. They have AIDS. They're gonna die. I remember so famously Ryan Phillippe, his first first character that I saw him portray, which was probably his biggest character, biggest role at the time, was I can't remember his name, but he was on One Life to Live. Or maybe it was General Hospital. I think it was One Life to Live because that was the only soap opera I watched. And he played
Hmm.
a gay character. Can't remember the character's name, but the character, obviously he was young, had AIDS, and he was the gay character with AIDS who would only come onto the TV once a year. Guess what day it was? World AIDS Day. And that was the gay
Oh,
character. That was the gay
there it is.
representation. And he would just come on and remind people that I have AIDS. My life is not good. I gotta
Yeah,
go. Yeah. I don't even remember.
I gotta run, y'all. AIDS, still full of AIDS. Gotta
Yeah.
run. Thank you so much
Yeah.
for having
Still
me.
got it.
I'll see
I'll see
you
you next year. Hopefully.
oddly around
Yeah.
this time next year.
And so that was the only purpose that was my impression. He may have had some other appearances on the show, but it was like so.
And not to minimize Mr. Phillippe's role in the show, but Pep's just going from her own
That's my
recollection.
recollection. And but it was clear that it was tokenizing is my point. And when it's tokenizing, it's like you're not there for the benefit of you or the AIDS and HIV community or the LGBTQ community. You're there for everyone else's comfort, just to say, okay, we saw one and we move it on. And they make money, directly or indirectly off of that, like the TV
Yeah.
show. And so that was when I started to be like, okay, they understand that we're here. They understand that people who have AIDS and HIV are there. And that the queer community is here, and they're just going to like use us. They figured out how they can use us in a way that's comfortable and distant enough. And clearly, maybe once a year on World AIDS Day, it was as comfortable as they could get talking about these subject matters. Like they weren't going to make it like the Mother's Day episode. And so that's
Yeah.
what I started to
And
see across the
there's
board.
there's a lot of there's a lot of plays about HIV and AIDS. There's obviously I think probably the most famous one is Rent. Everyone knows Rent, and then you also have
Mhm.
Angels in America, The AIDS Show, The Normal Heart, the movie Philadelphia.
Mhm.
So I think from my perspective, not living in New York City until 2008, and by the time I got to New York City in 2008, it was quite the phrase "it's not a death sentence." uh, I feel has become quite synonymous with specifically HIV and AIDS. In my mind, when someone says it's not a death sentence, that is literally exactly what they're talking about. And then, of course, there's also um, documentaries and then also I remember when I first moved to New York City, there's this queen named Stella Doro,
Oh, mhm.
and Stella Doro was working on a vaccine, on an HIV/AIDS vaccine. It was called Project,
Achieve, yeah.
Vaccine?
No,
No.
no, no, it's okay.
It's Project Achieve.
I actually worked for them.
Okay,
She
you
was the
took over the
queen of
role as the
vaccine.
queen, as the
Yeah,
vaccine
she was the
queen,
queen of vaccine. She was
and then you
the
took over as
inaugural
queen
queen of
of vaccine,
vaccine,
didn't you?
and it was an event called Project. It was for an initiative, a community initiative, a community health initiative called Project Achieve, which the goal was to connect people in the community, mostly through at gay bars and events, drag shows, with AIDS and HIV services and education, primarily HIV testing and volunteers for the HIV vaccine trials network, which was a network in the United States, a program which was similar to like sort of the pilot program behind the PrEP, which got participants involved in various clinical trials to try to test uh, vaccines for the HIV vaccine trials network. Obviously, PrEP, they were testing PrEP. And so they would get people involved in these clinical trials. People would go, they would get tested, they would, they would monitor their health, and they would find out about it mostly from Stella Doro. And then later on, when she sort of retired as the queen of vaccine, I became the queen of vaccine with Project Achieve, and it was together with Project Achieve and Columbia University were the groups that were partnering in New York. And the HIV Vaccine Trials Network's job
Mm.
was to get different HIV vaccines that were moving into the next stage of human trials, and find participants around the country to participate in these programs. And we tried all different types of vaccines. I think the one that was most promising was one that was a BNAB vaccine, which I think kind of similarly works to. I'm not a scientist, but I think it works similarly to how the most successful
Women in STEM. Women in
LAL
STEM.
COVID vaccine works. To my recollection, it would take a piece of a copy of the AIDS virus. It wasn't actually people. I think a lot of times when they think of vaccines, one of the fears is that you're just injecting the virus or the disease right into me to see how I do, and that's not necessary. That certainly is how some vaccines work, but uh,
That's not how vaccines work. That's
that's
not how vaccines work, yeah,
well,
flat out.
yeah, we're not. They don't inject you with AIDS, um, and see how you do.
And just
We
be
already
clear,
know what happens.
I'm pretty sure that's not how any vaccines work. I'm pretty sure that's not how any I don't think any vaccines are
Well,
injecting you with the
there
thing
are some
to try.
types of vaccines that are exposure that like rely on exposure to get your body's natural
So that
kickstart.
is how some vaccines work?
Uh, what do you mean?
I would say when I understood, I was looking up a lot about that. We're all experts on vaccines in 2023 because of the war going on with vaccines. Um, but I remember looking up something. I was like, oh, again, we are not scientists.
We're not.
We're not women in STEM. But what I understand, uh, the vaccines do no vaccines inject the actual. There is exposure therapy, but that's not what a vaccine is. Vaccines do not inject
They
what they're trying
develop
to
a
prevent
vaccine.
you
Well,
from
I don't
getting
want to
into.
talk generally about vaccines in general. I'm going to talk about the one that we were trying. The one that was the most successful that we were trying was called a BNAB vaccine, basically. And it basically gave a portion of a copy of sort of like the same structural code of the HIV virus, but it wasn't HIV. that was injected into that people would receive. And that was something that I think they had to go. There was a series of times they had to go. But anyway, this was one of the trials. It was very successful. It was the most promising. I can't say it was successful. It was the most promising. And they've since then, that was
Mhm.
like more than 10 years ago that I was involved in it. It was definitely about 10 years ago or more. And there's obviously not a marketable HIV vaccine to date, but there are instances where people, and we'll hear more from our guests, of course, about this. There are instances where
Yeah.
people have, in very specific and sort of anecdotal instances, been able to become HIV free, which is obviously a great thing. But we still have some great tools. But anyway, that was it felt really good to be able to connect the community with the HIV Vaccine Trials Network, and I worked with them for 10 years, and it was a great thing. But anyway, so that's that. But I
I
digress. You
just
were
found
talking
something
about
that I just want
Stella
to read
Dora.
this again. We are not scientists. I will read this one thing real quick, and I will move on from this. Live vaccines are derived from wild viruses or bacteria. These wild viruses or bacteria are weakened in a laboratory, usually by repeated culturing. For example, the measles virus uses a vaccine today that was isolated from a child with measles in
Yeah,
1954.
they essentially take
So I don't,
the antibodies that already exist, and at least this is how BNABs work: is that they take a certain type of antibody, and that's what you are exposed to. So the antibody already has. It basically is like this is like the most crude way to explain it. It's almost like a really good eyewitness that like remembers everything about the perpetrator and knows how they look, how they smell, how they walk, how they act, even how they look when they're in disguise. And you bring that eyewitness into your situation, and the rest of your body doesn't know about the eyewitness and how sneaky the eyewitness is, and the fact that eyewitness can kind of change and do all kinds of stuff. So, but this, I'm not the virus, not the eyewitness, the perpetrator can like change and do all this stuff. So the eyewitness is in there and be like, there it is right there. And then they teach that to all the rest of the other folks. And then everybody's suddenly a good eyewitness. That's like the worst way to explain that. But
it actually wasn't. I understood what you were saying, so maybe it wasn't
eyewitness.
a terrible way to.
Anyway,
Um, yeah, so and New York City is obviously. I think that
the
oddly
best place to
enough,
live. There you go. End
when
of show.
people New York City is a lovely place. I think oddly enough, New York City, there are two places you think about
When you
when you
think of
think about the
AIDS,
ravages of when we think about the ravages of the HIV and AIDS epidemic. I think people think about New York City, and people also just continuously think about the continent, the entire continent of Africa. And I think that's probably because HIV and AIDS have had significant impacts on both these geographic locations. And I think it's really interesting. I've never really done the full unpacking of that because I think it's because there's a lot of art and documentaries and pictures and depictions and stories about how HIV and AIDS have affected
mm-hmm.
these areas.
Mm-hmm.
And obviously, these areas have a lot going on outside of their impact. People are not just the sum of what's happened to them; they're also the sum of things they've created, what they make, what they do, not just what's happened to them.
Yeah.
Obviously,
Well, when I think it might be slightly like, I don't want to say generational because you and I are in the same generation, but in a slightly different age bracket, just barely. But for me, when I think of the two places that are like come top of mind with AIDS and HIV are definitely, especially AIDS, are San Francisco slash it's really Oakland, and New York. And New York, Oakland, because the North Pacific Northwest is where the earliest cases of AIDS were reported initially on a larger scale. Um, San Francisco being obviously a very large, openly gay and LGBT population in the 70s and 80s. And then New York also having that distinction. Uh, but the efforts that were sort of what was happening out of mainstream media in terms of the reporting of AIDS AIDS at the time. Information was coming out of patients and people in San Francisco, and seeing that this gay cancer was popping up all over the place, but like there was a sort of a large number in the city of San Francisco. And I digress just a second. Folks should really watch a wonderful documentary called Endgame: AIDS in Black America, which is really interesting, talks about the dichotomy between Black populations and white populations, both gay, San Francisco versus Oakland, which is, historically and predominantly, has a large Black population. And folks who would flock to cities, San Francisco, Los Angeles, New York, people would flock to cities like that, Black folks included. And then the gay people, gay folks of color and gay people in general would flock to San Francisco. People who had higher earning potential at the time were able to afford to live in San Francisco, which is a more expensive place to live. And then Oakland is sort of the outside of the closest you could get if you were poor, essentially. I don't mean to
The East
paraphrase,
Bay.
but or I don't mean to.
The Oakland's in the East Bay.
Yeah.
Yeah.
And so what would happen is people should watch AIDS in Black America, Endgame: AIDS in Black America. It's just really, really, really detailed and a captivating account of the early stories of AIDS in Black communities, which was not really documented and hasn't been talked about much in mainstream. We hear about the some of the earliest patients and AIDS patients being gay folks, but the people that are chronicled a lot of times in terms of documentaries and stories and things that people say, it's white folks, and they're not really talking about the Black experience when it comes to AIDS and HIV. In the early days, and what was ended up happening was, to be really short about it in a nutshell, um, the, there were lots of gay Black men in Oakland who would go into San Francisco to socialize and have sexual encounters. And that's how this was initially breaking into. I want to say that's, at least that's in the documentary, how they're saying this really started to get into, spread really quickly in the Black community, because they didn't have the same access to the sort of healthcare, even if nobody had great healthcare when it came to AIDS and HIV prevention, detection, and protection. But these folks
Mm.
were an impacted community that was not really protected, and certainly not really uh, wasn't really revered in the same way, structurally, systematically, or systemically, like some of the white populations were in San Francisco. Even the ones with AIDS and HIV, and the gay folks in San Francisco were, at the time, late 70s, early 80s, were still being discriminated against. And obviously people with AIDS, it was called gay cancer. And then people, once we realized what AIDS could do, people were like discriminated against regardless of their color. But it impacted people in Black communities and Black folks differently than it did white folks. I mean, that's just, because of all the other factors around their access to healthcare, socioeconomic status, their connection to their family, whether or not they were out of the closet or not, which we saw a lot of uh, stigma and shame, for everyone around being gay, let alone having AIDS or HIV. And in New York, the ACT UP was really, really, really instrumental in helping spread the word and alert people to connecting AIDS to the health system and medication, and AZT, and sort of all these notions that a lot of people would think about in the mid and early 90s about AIDS and HIV, was coming out of New York, because we were able to see these activists ACT UP, which is a group of activists that would stage demonstrations and sit-ins, and putting a condom over Congress people's houses, like a huge condom, like the size of a house, over their house,
Mm-hmm.
to draw attention to the fact that these politicians were not diverting, even giving any money to AIDS and HIV medication, life-saving drugs, and people were having to really, really, the gay people in the community were really having to try to find really unorthodox ways to get access to this medication that was happening in other countries and things like that. And that story was sort of co-opted in the movie Dallas Buyers Club, which is about a straight white guy. um, I'm rambling, but anyway, watch Endgame: AIDS in Black America. New York City,
Thank you for that.
Africa. I'm bringing you
Thank you
back
for
to your
that.
point.
And with that in mind, let's go ahead and bring up our first guest. Who do we have up first? Pep?
Oh my gosh. I'm really excited to introduce our very first guest, Glen Hill, who is a 71-year-old fabulous and person who has spent the last 38 years HIV positive. And he is a loving father and grandfather who happens to be sober for 20 plus years and fully retired. Yes, fully retired in America. What does that mean? I need to figure, I'm hopeful that we'll hear what fully retired means because, God, labor, that's another.
Maybe we'll
Yeah.
find out. Yeah,
Uh,
in this
a lot of
story.
people I know that are retired are still working. Anyway, he is super grateful to be both of service both to HIV and sober communities. And so, with that being said, let's welcome Glen Hill.
Okay, my name is Glen Hill, and I am 71 years old. I was born in Los Angeles, and I pretty much have grown up in LA. I have one daughter. I have a grandchild. I have. I don't remember when I was in, as far as coming out. I don't have an official coming out gay story. I was never in. I just was who I was, and I was blessed to have a family that didn't. They were pretty they accepted me without a lot of drama behind it. My daughter is 38. Uh, I was 37, I believe, when I got married, and I met this beautiful woman. I was never trying to be straight or anything like that. At that time, I was a flight attendant for one of the major carriers, and I saw this beautiful black woman sitting. I was coming from London, and she was the only sister on an airplane. And so she was coming to LA to for the first time, and we were talking, and she was asking about where the black folks were. And so I decided, I said, this is my city. Why don't I pick you up and take you and show you the city, and or show you at least Black LA because she wouldn't. She was staying at the Century Plaza, and I knew she would not see Black LA from there. And so that was kind of like it wasn't. It was it was I guess you say is official. It was a date, if you will, a date to go see LA. It wasn't nothing anything else. And then we just struck it up. And at that time, I was going back and forth to London, and so we began to go out and see. And when uh, I guess you can say I had this transatlantic relationship, and finally we one day. The funny thing is that she never knew I was gay, and she didn't have any gay people in her life at that time. And so so we were out and about LA, and all of a sudden I realized that it's time, like, let's go to a club. And I realized that I didn't know any straight clubs, so I took her to uh, the Catch One in LA. And she said, well, Jesus, the people here are so liberal because same sex dancing and all that kind of stuff, but she hadn't really connected the dot with me yet. And so it was when somebody had asked me to dance, and she said she kind of looked, and then she kind of thought. But anyway, that was the introduction to uh, me and her, and how we kind of came about. And it just, like I said, it just grew, or as I say, organically. Uh, and I met her family, and I never had to pretend that I was anything other than who I am. And then we had this moment when she said to me, she said, Glenn, I think I can handle you being gay. As long as there's not another woman, I think we're going to be okay. And I said, well, okay. So, so here we are today. I said to her, we had joking, I said to her, guess what? There's never been another woman. So, and it hasn't been. Never been another woman. And, but I'm a gay man. And, towards the end of the marriage, I was started to lean more and more uh, towards my towards being gay, and I never had to stop anything. But with the onset of the age that kind of pushed everything where I had to make choices. And I found out about 2 weeks before my daughter was born that I was HIV positive. And so there was this moment when I had to have my daughter tested as well as, um, during that period, the results were about 3 weeks or better, longer to find it. And during that period, I had to really look at what was right. She was not going to go out on me, and thank God neither are positive. And so once I got that news, I had to make a decision. I had to let her out of a marriage that was starting to fall apart, and like I said, she would not go out on me, but continued to uh, I continued my relationship with men, and the likelihood of me infecting her was, increasing. I couldn't do that, so um, I agreed to a divorce. I was not exactly shocked that I was positive. I was kind of numb, I just kind of rolled with it. Um, and it was like in '86. Um, and at that time, the only thing available was AZT. And I kind of went by, I saw my doctor. My doctor recommended, but I also went by what I felt was, I knew my own health. I mean, I was never a sickly person. And I saw what AZT was starting to do to a lot of my friends. They would get it and they would die. And so I said to I just had this thing. I just said, you know what? I've not been sickly. I want this shit to work if it's to work, and I didn't want to take it too soon. I felt if I took it too soon and something comes, the effectiveness would not be as strong. So I just said, I'm not going to take anything. And my doctor was saying, he said, okay, if that's what you want. And so it was never, I was never forced or made to feel anything. It was a decision that was respected, my decision, and I am glad today, obviously, that I made that decision for myself. My friends, like I said, my friends of history. Like I said, I knew in high school that I was gay, and I started to build relationships as early as that. So my friends of history, they all tested positive, and they started dying. And so I went through what we call the dark period. I remember when they had no name. I remember when we were afraid to even walk into a room. We had no idea of how the thing was being transmitted, and it was probably one of the darkest periods in my life. Um, but yet, life was still going on, and um, the, you know, of say there were roughly about 10 guys that I ran with. Of the 10, all of them died but one over a period of time. Um, I had figured that I was at peace with that I could die. Like, well, we're all going to die, but I was okay with knowing that there was a possibility that I could die from this, and I continued to just get on with life. Needless to say, I use artificial coping things to help me cope through it. Uh, I had gone through so many funerals that I actually had to stop going. Gay Pride was an event that I stopped going to because it was year after year you would run into people and they say, "Did you know such and such? Oh, they're dead, they're dead, they're dead." So those events became very dark for me. And then um, I just call it, I found relief in drugs and alcohol, and then my life really spiraled down, and I was resolved that this is how it's going to be. My friends of history were all brothers. Okay, so my as you could say my posse, that would be a word to use today. They were all brothers. Now my sex base was different. And those relationships were sexual, but not quite as close as my friends. And so all around me, death was all around. It did not discriminate. Um, and so, as I just kept going, you know, I just kept going. I have an idea of who it was because I looked back at who I was uh, involved with, and there was one that I mean, I don't know for a fact, so but there was one telltale sign. I didn't know I was looking at Kaposi's when I saw it, but he had these purple marks on him, and he is now he actually died of AIDS. So I would say now I don't want to say it was him because I was very sexually active, so I don't know who it was, and it would be wrong for me to say it was him. But I would say, given the lesions on his face, and he didn't have he wasn't a sickly looking person. He just had these purple lesions on. Uh, so I would kind of say that there is a 90% chance that I got it from him. How I decided, I said I'm going to make the best of it. I'm going. When friends died, I partied. I said I'm going to party a little bit harder, and I just kept. I I I I won't say I was not in reality, but I just kept on. I was young, and we just adapted. You know what I'm saying? We just adapted. I continued to have sex. It wasn't no, even though they were advocating for safer sex. Um, I that was not my. That's not what I didn't do. I was I just didn't do it. Now I did once. My sex partners, I always let them know in advance that I was positive, and I for the most part would would really only have sex if I knew with guys that were positive. You know, I felt more comfortable with that. I had accepted the fact that I was positive once I was initially diagnosed. It was how do I live with that information? And so I decided that, like I said, my coping mechanism, my copers were drugs. So I definitely, uh, I used a lot of drugs. Not saying, oh, I'm going to use this to escape, but if you look back, I look back at my history, I look back at what I was doing. It was definitely, it was probably uh, the beginning the beginning of the end, if you will, of me using. And I tested positive for, let's see, I say the first 6 years I tested positive. And then from 6 years to current present, I went undetectable without medication. I've never been on medication. Yeah. I I am what you call that they used to call it back then an elite suppressor. I am well sought after because number one, not my age and the length of time that I've been positive. So I'm one of those guys who was positive and having never taken any kind of medication, I am now undetectable and have been undetectable for at least 30 years. I have a very strong immune system. Um, I think that's also another reason, like I said, we were talking about the AZT and what I uh, not taking stuff. I went by I've never been a sickly person. So, uh, and even to this day, I don't know why it is that I, because the studies that I'm involved in, they don't tell me the results of those studies, but they do. They have sought me out, from uh, Boston to UCLA. Several institutions have sought me out. They take a lot of blood, okay, and they take a lot. They take a lot, and then they do this thing where they, like in Boston, they they take the blood, they take the blood in, take the blood out, and I guess you can rinse it, and this machine dissects it into all these little whatever, and they get what they want, and then they put the blood back in. I mean, it's kind of like a loop, and it takes a few hours to do it. They fly me in for that, and then they also test my nervous system. They 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 do a lot of. Oh, I've had what do you call it? Where they put you in that little tube thing, MRI. Where they, yeah, MRI. Now, ooh. you, now you talk about feel like you're in a coffin, that, brother. And you got to stand. You got to be perfectly still. I hate that. But anyway, I've had several of those, um, and like I said, then the psychological component, they do that too. Um, yeah, when I go in, they do a body of tests. And what I've done is that in many ways, it's my way of taking part in this. It's my way of giving to my community, especially those who have died and weren't able to. And like I said, I don't know what they find or not find in my thing, but one thing I do know that I have an opportunity to be of maximum service to my community, to my gay brothers and sisters who maybe might be able to be helped by these tests that I'm taking. So I would feel that if I didn't participate, it's being selfish. God, my God, has been very good to me, and this is my way of saying thank you. So I go and when they call me and tell me that they want me to be, if I want to still continue to be a part of these studies, I say yes. As long as they want me, I'm good. So I'm involved at least once a year uh, uh, in one or two of these studies every year. Um, and like I said, it's they fly me in. If it's out of California, they'll fly me in, put me in a hotel, feed me, and all that stuff, and they give you a little stipend. It's not the money. No, no, we did that. No, it's the opportunity to help. Being sexual is a natural, normal thing. Um, Being aware and taking care of oneself shows that you care. And so, uh, when you're young, yeah, I mean, honey, I had a very active sex life, and I still do now. I tell you what, by the way, ain't no shame in my game. Anyway, but what I do, like anything, uh, information allows you to make better choices. Denial does nothing but lead to death. Okay, pretending that you don't know I mean, that's not a solution. Like I said, when I was when they asked me, or like when I was diagnosed, I didn't know very much, but I knew this one thing is that I needed the information. I needed to know so that I can move about this world and know know what's going on. I don't want to pretend that there's not this epidemic out there that could kill, and I didn't want to knowingly infect someone. See, and so what I suggest to the young people is don't be into not whatever's out there. Take it. It's okay, and work with your doctor. You know, and go if you're sexually active, go go as often as you need to have blood work. If you are busy and you have unprotected sex, I know they use the word like safe sex. No, it's safer sex. There's only one thing that is safe, and that is abstinence. Everything else is safer. Okay, because there's always a small percentage that this, you could get the condom with a little hole in it. Okay, so and sex is not for children. Sex is for adults. And what I mean by that is that if you're going to engage in sex, you have to take responsibility, and you own whatever happened. Okay, I- I- you can't pretend that you don't know. That if you are uncomfortable, then keep your pants zipped up or keep your legs closed. Okay, because I don't care how old you are. Once you engage, you are saying, I'm an adult. And that means that I take responsibility for my actions, be it right or wrong. All right. And if you aren't willing to do that, then maybe it's not the time for you to be physically engaged. If you're not using protection, then you definitely are opening the door for whatever comes your way. You can't, I mean, there are other things out there besides HIV. Mean, really, you have gonorrhea, syphilis, all these things are out there that can be uh, prevented, if you will, by wearing a condom. But if you choose not to, then you have to own that responsibility. You don't go to the ball and expect somebody else to have it for you. You bring your own shit. Okay? You make sure that if you want to have sex with if having protected sex is what you really want, then you show up with your own condom. Okay? You take care of yourself. And if a person that you are with doesn't want what you want, then it's okay to say, you know what? This is not for me. Okay? This is not for me. And you have a good day. Because there are plenty of people out there who will respect your boundaries. Okay? Don't be don't be coerced into something that you're not ready for. And then you play the victim afterwards. No, it's a little late. Now, it, only in cases of rape or if you kidnap and you're taken against your will, you always have a choice. Okay? You can't say you didn't have, no, you chose to let that person let them trump you. Okay? Trump your what works for you. They ain't that damn hot. You're hotter. And the thing is, I've always said, look, when I give someone when I give myself to someone, I'm giving them a very precious gift. The most precious gift I can give anyone is myself, not my bank account, not my card, it's me. And so be careful who you give your gift to, because everyone is not going to appreciate the gift. Okay? And if you abuse my gift, meaning like you lie to me and you do all these things, then you know what? I take my gift back. Mm-mm. I'm not going to waste my gift on someone who cannot appreciate it. But see, I had to learn to appreciate that my own self. This is where my recovery comes in. I've been 20 years sober. And I didn't really look at me or any of my sexual practice or anything until until I got sober. I had to learn to value me. I mean, I had to learn to put boundaries. I had to learn how to say no and go, it was okay. See, once again, everyone is not going to respect me. Why should I think you would respect me when I don't respect my own self? Okay, when I am allowing myself to live in a false reality and do things that compromise a quality of life. And now I look at my body as my temple. This is my temple. This is not brick and mortar. This is my temple. This is where that higher power, the God of my understanding, dwells within this temple. And when I'm putting things in my body that doesn't support it, then I'm polluting the very thing that has given me life. Well, first of all, uh, I'm not gay daddy. I'm daddy who happens to be gay, who happens to be positive, who happens to be African American, all of these things. But who I am, I'm daddy. And then what trumps all of that is that I'm a human being. Okay. And so I brought my daughter up to not. I've never hid who I am. I was never ashamed. I never said that. Keep a secret. I never said, oh, you can't say. I educated my daughter on when she asked certain things, then I gave her an answer. I didn't give her a long story, but I answered the questions she asked because I was honest and truthful with my ex-wife. It allowed us to transition to where we are today. We are soulmates. I love her today more than I did when I actually said when we said I do. And she's married, and everyone knows. We all, her husband, her husband, we all respect each other. He had never tried to be daddy to my daughter. He was my ex-wife's husband, and so I if I taught my daughter, if I were to teach my daughter to be shamed, then I, you know, no. I told her she loves her gay dad. As a matter fact, she said something when she was about 16, and I'm single, and so I was single then. I'm still single. And she said, Daddy, do you want me to help you find your boyfriend? Now, does she need to help me? No, but the fact that the reason why she said that she wants me to have joy and love in my life. And she said, her thing, do you want, and no, I don't need her to help me find me a boyfriend. But the fact is that she respects and loves me so much that I can't say enough about her. And like I said, as far as the people that are most my family and all, it's because I've been honest. Because I said, if you don't, if you're going to have a problem with me being gay or even HIV, I need to know that now. Okay, because I can love you from all the way across the globe. I don't need to have you in my life, but I still love you. And I respect the fact that you can't deal with stuff, but you can't be in my inner circle. Or what if I get sick and I need you? And then you're going to tell me all this bullshit? No. So I'm very fortunate that not only my daughter, but my entire family is supportive. And they celebrate not only my gayness, but my HIV. I've never hid that stuff. And nor did they feel if they touched this or they had, no, we never did that. I was never made to feel less than. Our young people are very educated. Go on the internet. Everything is so readily available and accessible. And most importantly, it's okay to say, I don't know. It's okay to say, I have concerns. Okay? Now, don't live in fear. Fear means that which you cannot control, you fear. If you if you take your medication and say you are positive, you test, but it's not a death sentence. That's one reason why I've agreed to this project. Is that I need to let people know that it is not 38 years I've been positive, and so my thing is don't let people seek your own information. Seek the truth. The truth is out there. Libraries, their clergies, churches, the gay and lesbian center. It's everywhere. So if you don't want to know the truth, it's because you don't want to know. But hold your head. If you do test positive, hold your head up with dignity. It's okay. It's just information you need to know.
No, and Glenn is has obviously shared that he's undetectable, which is another I would say HIV/AIDS buzzword that you hear associated with HIV and AIDS, to the point where it's even on a grinder. Undetectable
Mhm.
is is something you can put in your
But
grinder
it's also an
profile.
actual
I don't know if
status.
any
It's a
others.
health status. It's a signifier for health
No, no,
status for sure.
of course it is.
Yeah.
Yes. I want to be clear. I'm not saying it's not a status. What I'm saying is it is a word that has made it into the mainstream that people are like, oh yeah, we all know it. It's even made it into the dating apps. Um, and when you are undetectable, when you have HIV and AIDS, but you're undetectable, essentially, and I don't know the numbers, but it is a monochrome of a chance, like 99.9% chance that you will not. Uh, those numbers are.
It's
It's a
higher
very
than
very
that.
high
It's not.
number.
It's definitely higher than that. You cannot pass, spread, or HIV, not AIDS. AIDS is
Yeah,
a
you can't transmit. Yeah,
disease, like, that happens to your body when you have
yeah.
HIV, and you're
It's
yeah.
when the condition furthers to the next
And
thing. Yeah,
so, but when you're undetectable, you on when you're properly monitoring your health, your viral load, and taking your meds, which is how people get to undetectable.
yeah.
It's not possible. It has not happened where people have spread the HIV virus to someone else through sexual contact. And so
Which I'm really intrigued by that, and how it's like, because by the time I got to New York City, undetectable was like already like a word that
Mhm.
we were
I
hearing.
don't know how
It hadn't made it
mainstream it
into
is. I
language. I
feel
don't think.
like in the queer community, it's definitely in the queer community that has an obvious connection to AIDS and HIV, whether you know somebody who's HIV positive or not, or just because of the stigma alone and people associating. Because there's lots of people who probably don't even know somebody, didn't know someone who was open about talking about their HIV status, but they are
Yeah,
queer in the community, and then especially if they're an adult, like over 20 or 30, probably have encountered, maybe over 30, encountered someone who maybe like discriminated against them or thought that they could be more likely to have HIV because they were gay. And so, like, queer people definitely carry that burden, or at least I don't want to call it a burden. Queer people have definitely have
carry the stigma,
carry the stigma and the effect
afflicted
of
with
the
that stigma.
stigma.
Yeah,
Hmm.
there we go. Yeah. So I'm really intrigued by how that term is made throughout, especially. Oh, I mean, again, this is speaking from the perspective of a New Yorker, how that
Who
term
lives in
was
Los
really
Angeles?
like I do live in Los Angeles right now. I'm a citizen of the world. I'm in Long Island right now,
Ooh.
in this palatial state. Um, but we a lot of us in the New York City queer scene and the hookup scene know what that word means, and I think that maybe a lot of times too, it's interesting how the public concern for HIV and AIDS shifts depending on who in the public eye has been afflicted with HIV and AIDS. So like when it's just a bunch of unnamed gays in New York City is one thing, but when it's Rock Hudson, when it's Magic Johnson, when it's Easy E, you know, all of a sudden it seems to get more attention from different people. And I just find that interesting. I also don't have any studies on who's paying attention to HIV and its effects on different communities and when different demographics become more aware or less aware of it. But I have to imagine that a lot of straight people started their ears perked up when they found out that Magic Johnson was diagnosed with HIV.
For sure. They definitely did. I think part of it is because, without being able to put a face to it, especially in the earlier years, most of the people who had HIV, they had HIV for a short time, which eventually moved to AIDS because there weren't any therapies or medications that were able to keep people as healthy as possible and keep them from dying, first of all, very early on. And when those drugs were invented or created, when those therapies were created and available in the world, viable, they people couldn't access them because that's the big sort of the linchpin, is that people couldn't access these therapies that were being a lot of them were sort of what we would call experimental, and our government, whether local, city, state, or federal, was not moving to give people access to what they were calling experimental therapies at the time, even though those were the only things that were showing promising signs of keeping people alive. And in order for that to have happened, for the government to be able to like green light essentially these experimental therapies and access to them, it would have to maybe work from the top down, but it certainly in the Department of Health and in the United States, our president would have had to acknowledge it, and Congress would have had to move to allow people to have access to these things and give people access to these things. And Congress did not do that. Our president, who was Reagan at the time, did not do that until his best friend, reportedly his best friend, Rock Hudson, died, and we discovered later that it was of AIDS that he died. And then that was the first time that President Reagan even mentioned the word HIV publicly on camera or anything like that. And so that was one thing. And then the other thing is, I think the biggest thing that brought an awareness of, I think honestly, Rock Hudson for a lot of the country was what told people what AIDS actually was, and they like, oh, AIDS is a disease that you can get, that lots of people have, and lots of gay people have, and oh, Rock Hudson must have been gay. Like that's all. I think that's as far as people's minds went with Rock Hudson. But it was
Mhm.
really the story of Ryan White that really personified the face of HIV, because Rock Hudson was secretive or quiet about it until he died. And then so we didn't get a chance to see someone walking and talking who was living at the time with either AIDS or HIV until Ryan White, who was a young boy who reportedly had contracted HIV and then AIDS through a blood transfusion. And he was 10, I don't know how old he was. And Michael Jackson was like, everybody wanted to like take care of Ryan White and give him comfort and joy in what would have been a death sentence and what ultimately ended up being a death sentence. And so suddenly he was with all this movie stars. Michael Jackson was coming around there. Like everybody was like, Ryan White, Ryan White. And so that was the first person who was sort of positioned in a sympathetic view when it came to AIDS that I can remember. And then second, after Ryan White, was next person we heard about was Magic Johnson, and that was the most high profile person at the time, who that we had heard about, besides Arthur Ashe, who around the same time, was as a tennis legend, obviously, and it was also black. And so that's when it started to become more humanized, which is what we needed.
Yeah, I agree. We should
We should
keep the
keep it
ball
going, y'all.
rolling and talk about some more
I can
people.
talk about AIDS and HIV till
This
the
next
cows come
person,
home.
this next person is obviously very close to me. He was essentially in raising me. He is my uncle.
Hey.
Uncle Steve. Uncle Steve is a gay activist. He's a chef. He's a minister. He's a father. He's a grandfather, actually. And my Uncle Steve has been living with HIV and AIDS for as long as I can remember. I don't remember when he serocerted, um, but it's been a part of his ministry for a very long time that he's been living with HIV, and he's very open about it, especially in his religious circles. Um, and I think that he's important. He feels it's important to make it part of his religious ministry, that that God has helped him see year after year after year. My
Hmm.
uncle's in his 60s. He's probably 60. If my mom is 61, my Uncle Steve's probably 64 ish. Um, so please give it up for my Uncle Steve, Uncle Steve Caldwell.
Hey.
My name is Steve Caldwell. I got to a point in my life where I realized that I geared toward men more so than I did women. Go through the journey of acceptance, you know, and also I continued to have other people in my life because my daughter's mother, she was my friend before she was ever my girlfriend. So that was a confidant, someone I could share my experience. I felt comfortable sharing things I was going through or had went through. I had also had a bout with drugs and alcohol too. So those are coping mechanisms for me to maneuver through my life. I gain acceptance as well. So in that aspect, I began, Atlanta allowed me to have my first real queer relationship with a guy, and in the aspect of having that, that's when I brought my daughter into my life. My daughter was, I think, ninth grade or 10th grade, somewhere in there. And me and my friend David was together. And that's what I found then, that this is where I need to be. This is where I'm feeling love. This is where I can connect and deal with a whole lot of things. Because at that time, too, I had been diagnosed with HIV as well, and I have been living with that now 42 years, you know. But in the midst of that, that all brought everything into clarity far as that relationship. It was now I'm not on drugs. I'm not doing it because I'm pimping myself out for drugs or anything of that nature. I'm more so trying to become a productive member of society. For me, I always I never hid in the community. I was just me. Because for one, at that age, I found out, came to myself. I I never hid anything. And then my mother, when I came out to my mother, and shared with her, for one, and one I came out, even had to come out because, but one time she caught me in the house, in the act. And so, in that aspect, my mother just told me that she loved me, and she also told me whatever you do, be the best at it. And so I never really hid it from other people. People would assume because I'm a kind of soft spoken type, but too, and I'm a caring individual. So in that aspect, a lot of people looked at me as being or and I danced. I danced a lot. I was considered a professional dancer at that time. I had my little dance groups and everything, and we did those things. We traveled, but the point I'm trying to make is that my mother was the first on that part. My mother was the first. I came out to even with the HIV, her and one of my siblings, and then my daughter. I shared that with my daughter because my wife passed. I never got with anyone else, and my mind always, honestly, um, at that time over her, I was like I was with her. You hear me? And I'm not going to be on here and say like some gays that oh, I know God delivered me and this, that, and the other. I'm comfortable in who I am. I have a personal relationship with Him, and that's what matters to me. And it's not who I love; it's the fact that I can love, and love um, covers anything else that would tear it down. And being transparent with the individual, I had to grow into that. Not keeping secrets, but being walking in my own truth is what I'm trying to say. And even with my wife, I she knew everything. I didn't hide anything, even though people knew about when I got married. Oh, girl, he used to do this and he used to do that. But the bottom line, I already had made her aware that I had HIV. I gave her a choice because I work in that field as an educator as well here in Atlanta. So my thing was to give a person a choice in the matter. And I truly wasn't looking for going to jail by sleeping with someone and then they become positive, and then I have to do a jail sentence for that. But I learned to be able to be all right. I found out I was HIV positive on the latter part, 81 going into 82. I began to cry because I was around people that that I saw was dying. I began to see movies that were being made portraying the people as being these dead, sickly, sores and everything. And more than anything, because of me living a fast life, I look at the fact also at times my mother. When I did go to my mother didn't want her to believe it. She said, "Oh boy, what do you need now? You must want something, because I was just that person. When I was in the tight, I made sure I got to my mother, or someone that was very close. But dealing with that at that time, I was scared. I was in fear. But by the grace of God, He blessed me to be a part of a group called Our Common Welfare. And in the midst of that, I began to be a part of that, and I was elevated in that support group because um, they saw the potential in me that I didn't mind talking about me. I was open with whatever was dealing with me. I would go on panels there at Morehouse and talk about living with it because talking about it, it took away the stigma for me, and it took away the fear of death, and what I was seeing. But it also set me up to be able to do a better taking care for health wise, take care of myself, learn how to know what the regimen was. And at that time, they couldn't regulate Quicksavan and the other I can't think of it right now. But anyway, it was one that was it was geared toward white men, and more of them worked better with there because that's who they did the study with than they did a group of black people, and it was horrible because it changed with the colors of my nails. It dealt with my skin a little bit, the side effects, but I made it through that and got into some studies. That's what helped me as well, get into volunteering myself to be a part of studies to be able to help. I have so much love I want to give. Until you learn how to love yourself, you can't love no one else. I don't care if it's your children. I don't care if it's another adult individual, but love starts with you. Change starts, and it's like the metamorphosis of a butterfly. You're in the cocoon, but you have to go back. I had to go back in me and be able to pull out what I have to give today. We're that village. We have to be that village to the ones that don't know how and the ones that are coming in.
It's so great to hear your Uncle Steve, who, hey, if he's your uncle, he's my uncle too. In the podcast.
Your uncle's
Uncle
my uncle
too.
too.
Is that John Jacob Jim Goldheimer Schmidt? Is that what that song is? Yeah.
Yeah, yeah.
uh,
Honestly, no one talks about how John Jacob Jingleheimer Schmidt is a full-on bop. Like, if there was a chart topping of all the kid sing along
yeah.
songs, obviously, I think "Twinkle Twinkle Little Star" is going almost in number one. Mary Had a Little Lamb is
No,
clearly going
Mary
to
had
be
a
up
little
there. No
lamb.
one's even.
Wasn't that more
But
well
John
known
Jacob
than
Jingleheimer
than,
Schmidt.
than that?
No, they're all up
Yeah.
there. But I'm saying justice for John Jacob Jingleheimer Schmidt is all I'm saying.
What about Johnny Appleseed? Do you remember that?
Johnny Appleseed.
No,
No,
that's
that
not
was
how
Frere
that was.
Jacques.
No, that's not Frere Jacques. Frere Jacques is Frere Jacques. Tommy.
What's da da da
Yeah,
da 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 da
that's a French one as well.
Jump to alouette, something in French.
Voulez-vous coucher
See, that's
avec
not.
moi ce soir?
Is Frere Jacques French?
Yes.
Is that a French term? What does it mean?
Fair Jack, I think.
And what is alouette mean? Alouette, jump to alouette. What does that mean?
I don't know. Let's keep going.
Okay.
um,
Anyway,
it's
but yeah, my Uncle Steve was probably the first person in my life that I knew who had been who was infected with the virus, who's serocerted and
seroconverted.
and is it called seroconverted?
Seroconverted.
Seroconverted. Oh no, zero sorting is when you look at someone and go, well, if you say you don't have AIDS, and I just believe you don't have it, or you say you don't have HIV, and I believe you don't have it. I believe, if I'm correct, I remember they were saying. I remember in New York City, there's like a lot of talk about like HIV and AIDS, and they're like, serosorting is not a means of prevention, and serosorting is when someone just goes, well, I don't have HIV, and you just go, okay, and then you just have sex, and you're just like, well, you said you don't, so
It's just it's
so
a
we're
clinical,
good.
seroconversion is just a clinical term for testing positive, essentially. The point at which you can go from, it usually happens in a few weeks, go from testing negative, even with HIV, after HIV exposure and HIV in your system, to now you testing positive, which means it's all kind of kicked in. That's what it means,
Mhm.
essentially.
So my uncle was the first person I know who ever who has the HIV virus, and especially is open about it in my life, and I think that it helped me with destigmatizing.
For
I don't want to act
sure.
like I was too young to ever have stigma, because I'm sure at some point in my life, but just growing up being raised by someone who was open about it, who like cooks my food and hung out with me, and I remember like everyone in the world, he would like get a cut, and no one was like, ah! We were all like, oh yeah, Uncle Steve has a cut, just like everyone else has a cut. Like this is clearly not the end of the world. Like this happens.
Mm-hmm.
So I think I think because I had someone like that in my life, I don't think I ever really had the fear of that like really irrational
Mhm.
or really terrifying fear of people who have
Well,
HIV
I
and
think
AIDS.
that there's different types of stigma, right? Like, so there's the interpersonal and then there's the institutional. And I think one of the biggest examples of the institutional stigma with AIDS and HIV, one of the biggest examples that I'll think that I can, like a very large example of institutional stigma with HIV is like simply the act of giving blood, which we hear about so much about that's really important to give blood. Obviously humans need blood, and we give blood from people who are, have blood to give. It's used for people who are sick essentially and who need the blood. And in emergency situations, a lot of times when you don't have time, you don't have like months to lead up to it, this person is in a car accident or something, they need blood now. And so there's been a lot of initiatives with the blood bank to get people involved. It happens at the high school level, starting in high school, and then through adulthood. Lots of people want to do their duty to give blood, and have been people with gay folks, gay men, very particularly, and sort of by extension, trans women and people assigned male at birth have been excluded and banned from giving blood until very recently. There's been some incremental, significant but incremental improvements with that. But they test the blood anyway, and so like for 30 years, I believe there was a ban on if you were gay or if you were a gay man or have ever had sex with another man in your life, whether protected or unprotected, we don't want your blood. And that is some discrimination. And I think a lot of people can internalize that as like, ooh, the blood of anyone who's had sex with men
Oh
or
no, for
who's gay
sure.
is like, poisonous. And it kind of perpetuated that stigma, I think.
First time I ever tried to donate blood was after Hurricane Katrina. There was a blood shortage, and there was like, all right, everyone, go out there and donate blood. You all need to be donating blood. We need it. We're in a shortage, and we need blood. So me and my friends were like, let's go donate blood. Now
Came in and dragged.
we weren't all gay. I didn't know that many gay people. I was in college at the time. I didn't know that many gay people. So I showed up, and they asked you all these questions. Do you have sex for money? Do you do this? Do you do any intravenous drugs? Or
Mhm.
and then they were like, do you have sex with men? And I was like,
Yeah.
yeah. And she was
Nope.
like,
Out.
and I was like, excuse me. And she was like, you can't give blood if you're a man who's had sex with men. And I was like,
Ever.
and now I was at the time like I was like 19 years old. I was like, I thought y'all niggas was on a shortage. I thought y'all needed this
Nope. And they don't
this
announce
good
it. They're
good.
like, they
Honey,
don't announce it.
honey, you need this, honey. I got what you need. I got what you want. I got what you want.
Got
I
what you
got what you
need.
need.
Another shot.
And they suddenly didn't have time for me and
Time.
my may or may not be tainted blood. They didn't have time for me or my may or may not be tainted blood that they had. That they swore. They told me on TV. They just told me they needed
Yeah,
it.
and girl,
The
they
internet just
let you.
told me
They're
to go
like,
down.
come down here. We want you to pay to come all the way down
And I was
here,
like,
rearrange your work schedule, change your life to come all the way down here just so we
okay.
can tell you we don't want nothing to do with you.
I said, here I come. America's in need.
Nope, not from you.
A friend in need deserves blood
We wasn't
indeed.
talking to you.
And girl, when I got there, clearly not me. So I was really
Yeah.
blown away
So that's how you
at
experienced
19 when they
the
were like, we don't
stigma.
want your gay ass blood.
Yeah. That's how you were personally affected, and one way that you experienced the stigma of AIDS and HIV, even though you obviously we don't I can't talk about your health status, but I'm assuming you've been tested for HIV and they test the blood anyway. Do you know what I mean? Which is so like,
Yeah.
come on, y'all. Yeah, it was in
I
1985
don't
that they
know. I
implemented
don't
the
think it's
ban,
so.
and then I think in 2015 they sort of softened it and said, well, you could have had sex with a man in your life, but if you've done it in the past like year, then we don't want you. So they kind of
3 months.
inch closer.
I think
Hmm?
I feel like now I think it's like I don't know if it is officially at 3 months or if it is
For
like or if
testing.
that's like one of the old laws. But there are lots of places still where you can't give plasma or blood if you're assigned male at birth and you've had sex with someone who's assigned male at birth in the past 3
Well,
months.
it's
Which I'm like, I got to give 3 months of celibacy to give blood. This is
well,
crazy.
that's because that's like the window of time from an encounter to like sort of mm, when a lot of people would go to get tested, that's the shortest window of time that people have seen from exposure to seroconversion. And so that's understand why 3 months is certainly better than 12 months, why people would come to a number if they felt like they had to come to a number, but I don't understand why you have to come to a number. Obviously not, I don't work with the FDA and the blood bank and the American Red Cross. However, um, you know, you're testing the blood anyway, so like what difference does it make? But they have leveled, I want to update people, they have leveled the I think in just this a month ago in August, they announced new guidelines that basically level the playing field. And so there are it's not as outwardly discriminatory towards assigned male at birth people and trans women. If you the asking you that history, I think it's more focused on the testing and the knowledge of one's status rather than just your sexual history as a way to exclude people. I don't have the updated information, but it is much better, but it's
Well,
not 100%. The best way would be,
also, apparently, red blood cells, apparently, donated blood can only last for 42 days. I just
which is
Googled
why they're constantly needing it
that.
for everybody. You know,
Something really this is really non sequitur, and then we'll move on to our final guest. But sometimes I Google information to find out. And I was trying to remember what year was that I got turned away, so I had to Google what year Hurricane Katrina was. When you Google people, there's always a
2004.
picture of them. 2005.
Okay.
But if you Google if you Google a picture, it shows you like a picture of if you Google a word or a person. Like if I Google peppermint, it'll be a picture of you on the side. And there's like a picture of Hurricane Katrina, which I
Picture.
don't know why I found that so interesting. It's like as if she's like a person. So it's give all this information. There's like a little like picture of
What
the
does it look
hurricane
like? Is it
on the
like a
side,
little
which I
smiling wind cloud?
it's a swirl. It's like
Oh, it's
a
like a
big
radar.
swirl. It looks like a big swirl of cloud.
It's like
Yeah,
radar.
it's just a big swirl of cloud.
Okay.
Yeah.
Wow.
And also, last thing I'll say too is I don't know who's working over at Google and who works over at Wikipedia, but whoever's job it is to make sure that the worst picture of me is available upon searching me,
Girl,
I wish nothing
what I don't even know
pain and
how people
sadness on
got that
you.
picture of me on Wikipedia, which is what Google
I
uses.
wish extreme sadness on you because it is. I'm gonna go ahead and call homophobic when and I can't get the picture I want on there. They will not allow me to have a life where the picture of me on Google or on Wikipedia is just nice. So you know, I hope that may your clothes always come out of the dryer just a little too damp.
With that being said, we wanted to say thank you to our last guest. Our last guest is a 37-year-old cis gay black man who's been positive for 17 years and sober for 4. He has worked in HIV health and currently works for an specialized LGBTQ rehab. And yeah, let's welcome Robert Evans.
My name is Robert. I am 37 years old. I work in treatment. I've been HIV positive since 2005. I was born in Northridge. Recent revelations have shown that I grew up in Inglewood. I forgot about it. So I'm from the Valley and from Northridge. So um, regular black parents, they got divorced when I was 2. Mom was a debutante. Dad sold drugs. Um, and oldest of 4. I found out I was gay maybe 10th or 11th grade because there was this man who looked like Shamar Moore. He was a senior. I was a sophomore. He was light skinned and had good hair, and I was in love with him. I was going to marry this man, and he got into NYU and broke my heart. He has a wife and kids now. It's fine. We had sex in my bedroom all the time. Now I think about it, with the topic, it was unprotected sex. There was no talk of HIV or anything. I had heard of AIDS. I knew that AIDS was a thing that happened in the 90s and the late 80s. I knew of condoms, but I thought that that was for people who were sleeping around. It was just me and this guy. And also, I was a teenager, so like, where am I going to buy them? Where am I going to hide them when it's done? What happened if my mother finds out? Like, the rush of wanting what I wanted mattered more than the health scare because I was a teenager. I was invincible. I could do whatever. I got into Cal State Northridge, and it was just there was so much more. There were so many more men and boys and choices and parties. And I wouldn't even say I was promiscuous. I just had more access. I started to hear more about other things that you could do. You could top, you could bottom, you could be first. What a wild thing that was. And nobody was talking about condoms. It was 2003, 2004. And no, like, I can't tell you one time where I had sex, maybe one or two times where someone was like, here is a condom, or here, let me put one on. It was a thing that I felt like my age group of gays, we knew of AIDS as this off distant thing in the past. It was this thing that happened. The only other gay person I knew until I went to college was my Uncle Junior. And he was an older gay man. He had a sew-in bob. He wore furs. He drove a classic vintage Rolls Royce, and we all called him Uncle Junior. Still don't know what his actual first name was. It wasn't until like my 30s that I actually met other gay men, gay black men over the age of 40. HIV scared the black community so much that it made gay being worse. Because if you were gay, you were going to get AIDS and die. Period. Like, gay equals death. So I can see how if there was someone who was gay who didn't want their family to think that, oh shit, they're thinking that I'm going to die, wouldn't say shit about it. Wouldn't say anything about it. My drinking had got really bad. I had dropped out of Cal State Northridge. I was still living in the Valley. Started dating this guy from Chicago, and he would get drunk and he would tell me about these studies that he was doing for HIV. Just like, oh, I'm doing these studies. I'm like, okay, babe, sure, whatever. Still thinking of HIV and AIDS as this thing from the past. At the time, like, I was a serious monogamous boyfriend person. I slept with my man and my man only. And then when I got done with that man, I'd find a new man. So anyway, we broke up after a year or two, and it was like a week or so before Halloween, 2004. I had been feeling sick. I had been having night sweats, yada, yada, yada. I went in to get an STD test because maybe it's an STD because I had never had an STD. And I went into, I don't know if we should say that. I went to this hospital conglomerate that has lots of hospitals in Southern California and did a bunch of blood tests. Halloween, went out being gay, underwear. And of course, I had a new boyfriend because that's what I did. And the phone rang November 1st. Hey, it's Dr. So and so's office. Can I have your name and your date of birth? Yeah, sure. Okay, so your STDs test came back negative. You were negative for chlamydia, gonorrhea, syphilis, yada yada. But you're HIV positive, so you should come in and make an appointment. Okay, click. I was hungover, one, because it was the night after Halloween. I was laying next to my boyfriend at the time, who I just came in a couple of hours ago. And they told me this over the phone, which at the time seemed normal, but like to like look back at it, so irresponsible. I could have ran out into oncoming traffic. And I had a family barbecue that afternoon. I didn't have time to process, so I didn't. I shut down. I kissed the boyfriend. I hopped in my car. I went home. I showered. I went to the family function and literally pretended like I never got that phone call for about 3 weeks. And by Thanksgiving, I had full blown AIDS, had 82 T cells, and viral meningitis in my spine. I couldn't turn my neck.
Hmm.
I was in so much pain. And mind you, I'm 19. So there was no logical reason why this young 19-year-old kid should be in so much pain. And I went into the doctor and they ran a bunch of tests. And well, because I went to the same hospital, they knew what my previous test results were. But because I was 19, they couldn't tell my parents, so I told them not to. They did a spinal tap, viral meningitis, isolated me in a room because because I was sick. And I was so sick that when I got my first HIV regimen of meds, it was 4 medications. One of them had to be refrigerated, and 2 of them were twice a day. Um, they sent me home with my mom because I lived by myself and I was like sick. And my mom went through my paperwork. It was very much so my intention to never tell anyone. I was just going to get healthy and live my life, and no one's going to fucking know. And so she went through my paperwork, and I remember hearing her on the phone because my mom talks loud, but she talks about you as if you can't hear her. Um, and I remember her like crying to my aunt, like, I knew this was going to happen. This is what happens to them, yada, yada, yada. My parents found out I was gay in May. I had HIV by November. So in May, my dad kicked me out. My mom told me my soul was in peril. She's a little dramatic. Um, and I had not spoken to my family that entire summer. It was the boyfriend who was telling me about the trials and tests that he was doing. To this day, and we've had talks, well, not talks, we had a talk. Recently, he still thought that he was negative. He claims that they were telling him that the strain that he has was not contagious and yada, yada, yada. I've done some I have done some work on myself to not hold on to that because that doesn't serve me to be like, you gave this to me, because at the end of the day, I was grown and I made a choice to not protect myself, but I got it from him. I got it from him. When I found out that once I got healthy and I found out that it was him, I went to his job. He worked at a smoothie shop. And I walked in and I ordered a smoothie from him. And he was like, hey, how are you? I'm like, I'm fine. You gave me HIV. And I walked out. I did not handle that well. But yeah, my family found out. My mother found out. My mother is the type to tell the entire family. And it was like in an instance, I had my family back. Prayer warriors everywhere. I'm still struggling with how I feel about that. Because when I was gay, you didn't want anything to do with me. But when you thought I was dying, okay, well, now let's go back to loving him. You don't know what you've got until it's gone. Or the fear of losing something changes people. I just wish that it didn't have to be that way.
Mm.
Like, there's still a small part of me that's like, had my family not disowned me, would I have ran into the arms of this man? I'll never know that answer. I'm perfectly fine and proud being an HIV positive Black man today, but like, I was fucking 19. My early 20s were trash. I
Mm.
did a lot of damage to myself behind that unresolved trauma of like being HIV positive at 19, because this was before PrEP and this was before all of the things in my head told me. And this is something that I've learned in like therapy, was that at 19 was the first time I gave up on myself. No one's going to love me. I'm not going to find a lifelong partner. I'm always going to be sick. Like, there is a permanent chink in my armor, is the story that I told myself. I know that that's not true today. Like, I'm very, very much so aware that like, I'm not perfect, but I'm damn good. I wonder sometimes what my life could have been like had that chain of events not happened. There is no way that I'd have the strength or the self love that I have. Like, I take care of my body today, not only just because I'm a man of a certain age and like, shit is shifting and changing, but like, I know that I have this thing that I need to take care of. And had I not, I'd probably still have that like mindset of I'm invincible and I don't need to worry about blah, 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 blah. Like, no, when it's cold outside, I need to put on a jacket. So when I first got home and got on meds and stuff, like, they signed me up with a bunch of like self-help groups and things like that. And I went to a lot of support groups for gay men with HIV. And looking back, I didn't take them seriously at 19, but I'm grateful that they were there because my head told me that it was just me. I was one of the younger people in those groups. Um, but I am grateful that it started me going to therapy. I've been going to therapy on and off since I was 19
Mm.
because my drinking and my drugging got really, really bad around 19, 20 because I didn't see it then, but like I didn't want to think about these pills that I have to take every day. I'm 19 years old. Why am I having the little things with the days and all of that? And like, so I drank. I had to be free. I had to be wild. I had to be crazy because I had this thing that might kill me. So I think I amped it up. I did the most.
Mm.
I did the most. Like nothing was going to be taken from me. I went the opposite end. Like not the poor me, but no, fuck this.
Mm.
I'm about to be out here in these streets, at the bar, at the club, another club, brunch. Like that is how I handled it. Because that's how I handle things sometimes. Like I don't sit in self-pity for too long, but I'll go the other destructive route. And I definitely say my late teens, early 20s were fueled by that. And therapy helped. I want to say that what changed it for me really was the medication changing. I went years without taking meds
Mm.
because I just refused to take all these meds every day. I was young, and I think maybe that's why I wasn't so affected. I didn't become undetectable until like my mid to late 20s, but I never got really sick from not taking my meds. Luckily,
Mhm.
luckily, like I was in a relationship with a man for 9 years that I didn't tell I had HIV until we had been together for 6 or 7.
Mhm.
Um, Never took my meds.
Mm.
Never took my meds, was perfectly fine. He was not positive when we met. Like I have had to deal with the fact that like my cowardice or my fear around being upfront and honest gave someone HIV. And we were together for 9 years. Like even after he found out, we still stayed together for 4 or 5 years. There was a lot of unresolved trauma and drama around the decision that I made and then the decision that we made to still kind of push through that. But I want to say that what shifted me feeling like less of a broken person was just taking one pill. I could do one pill and not feel like I was a bad guy. There's days where I forget I'm HIV positive when I found out at 19, it was the first thing I thought when I woke up. Now I see these little billboards for PrEP and PEP and all of the things, and I'm like, oh, I've had that for a minute. Like, y'all, like sometimes I find myself not having a lot of compassion for people who are newly diagnosed. When I found out about PrEP and Descovia, I was furious
Mm.
because the first PrEP was Truvada, and Truvada was like part of my regimen when I first found out. And my thoughts were, if y'all had this the whole time, what happened to me?
Mm.
Because I think I had been positive like 4 or 5 years when they first like started to like talk about PrEP. And I was fucking furious. I was mad. I was jealous. I was mad at Big Pharma because they knew and they just wanted to make money. And I went into a YouTube deep dive. I was so fucking mad that why not me? And then at some point I just stopped caring because like it wasn't going to change. And I was down to one pill and like, okay, like maybe this keeps people from having to go through what I went through. Um, and now it's just so popular. No one is worried about HIV anymore. When I hear people who are newly diagnosed, I wonder, I know how HIV is transmitted. I just wonder how, with all of the access there is now to medication and free meds and PrEP, how it happens. I try and stray away from blaming. I couldn't imagine those feelings that must come up becoming newly diagnosed with all that's out there now.
Mm.
There wasn't as much when I was diagnosed 17, 18 years ago. But like there's a billboard within a mile of here talking about PrEP and PEP. And it's on commercials and it's, like it must be really tough being diagnosed now. I'm sober and I go to a lot of gay AA, CMA meetings, and there's more older white and Latin men, which I'm grateful for because they've been sober for a long time and I have that experience to like build on. But there's like a couple, I've been sober, it'll be 4 years tomorrow. I can name four, I know, I can name four older gay black men in the rooms of recovery in Los Angeles. And I go to a lot of fucking meetings. So like I'm not saying that those are the only ones, but like if there were more, I would have seen them. And that math is off. That math is off. Like I feel like, and I haven't done the like research to know, but I feel like what white gay men lost during the AIDS epidemic is a fraction of just entire groups of people, of black and brown people, to where no one survived to talk about their friends that they lost because everybody died. Everybody died. I couldn't fathom the friends that I have now dropping like flies. Could not fucking fathom. But it sucks because not only did we lose the education of HIV and AIDS, but like just coming up, dating men and going to the club and girl, watch out for him and don't go to that bar. And like, no, we have to figure that shit out on our own.
Yeah.
Like we had to figure that shit out on our own. Whereas now these baby gays, you know, they have something or they at least have some access to education and the culture. And I didn't know much about ballroom until it became popular on television. I've never been to New York, and like anyone who was coming up gay in that time who was of color probably died. Probably died. To where I had to learn about it on fucking television with everybody else. I wish that wasn't the case. I think not that I'm putting this responsibility on myself, but like if I go into a room and I see a younger queer gay, like we here, we don't have to like kiki. Like I'm not going to be friends with everybody black. Like people that know me know that that's true. But like to be seen matters. To be seen matters so that we can pass along some of this shit. It's not going to change the world, unfortunately. But I feel like there are lots of things that maybe I didn't have to experience, or not even experience, but experience alone. There was a lot of loneliness. I go to a lot of meetings, and the younger queer black people who are coming into the rooms, they're like, we see you, like, why don't you sign up for more things? Why don't you get on the board of this and the board of them? Like, bitch, I'm just trying to stay sober today, girl. Like, but there's not a lot because there's like us, and then there's 40s and 50s, and there's a gap, and that gap is the AIDS thing. Like that's the gap. And so if I'm 21, 22, I'm probably going to connect with someone more in their 30s than someone who's in their 50s. This year, really. This year, as much as I want to like rag on myself about what I haven't done and blah 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 blah, like I'm not seeing myself, but other people are. And that's kind of cool. That has been uncomfortable. It's been uncomfortable because I just want to like go to work and pay my bills and go see Beyonce and take my meds and check in with my mom. And but it's a gift to still be here because there's a lot I couldn't fathom. Like I would love to look into it, but I think it would be too much. I don't want to know the numbers of
Yeah.
how much was lost because I would even question how accurate they are. Because they still treat black people crazy. So think about what it was like 30, 40 years ago. That math wouldn't math for me. I still live my life, but I think about more than just myself, which is great, which is challenging. But it is, I think about more than just myself and like, what am I going to pass on? I might have kids. I don't know why. I might buy some kids one day, but kids are expensive. Hell, surrogacy and all that shit is not cheap. I have to buy me some kids, and they better act right. But I think about what I'm going to leave on this world. Like, what am I going to leave? Am I just going to be another gay who was out here at the bar till he was 50, 60, and then dip. No, no, I don't. I am not exactly sure what it will be, but I want it to be something. I want it to be something to where people will speak of me not in, oh, whatever happened to so and so, but like, oh yeah, he did this. He stood for that. He spoke of. It's not about a accolade or an award or, but like just to leave behind something to where someone else can carry something of value. Not just, oh, you know what? He was great at throwing that ass in a circle, like, but also gave a fuck about standing up for trans people. Gave a fuck about making sure that we're seen in any space, not just the BIPOC spaces, which I'm always grateful for. No, if I'm the only Black person there, then I'm just going to be the only Black person there until I'm not. Because if I don't show up, then no one ever sees one of themselves. I work at a LGBT focused rehab, which is one of 3 in the country, which is still wild to say. Our entire staff is queer. Our entire curriculum is built around helping queer people. And I always tell our clients that like getting sober is hard enough without having to worry about your pronouns or your HIV status or being able to talk about this thing and that thing that are very specific to the things that we go through. And the company that I work for is owned by this proud Puerto Rican man. And I don't feel like I work at one of those white places. We are very like, and sometimes that's a problem. It's that like, okay, there's too many colored people. We have a good time, and it always warms my heart when someone is coming into treatment and sees something that they weren't expecting. They hear me on the phone. I'm from Northridge. My voice is a little whatever, but they see me like, oh shit, you Black? I said 37 years, girl. I've been Black a long time. It's nice to be able to share my experience. I've had a couple of clients find out they were HIV positive in treatment and freaking out about it. And it's been so nice to just be like, okay, freak out. You're going to have your feelings. The game has changed. You're going to be okay. No one's going to love me. That's not true. I got plenty of hoes. You be just fine. Plenty. You'll be just fine. It has been nice to I've had several clients tell me that they had never spoken to another HIV positive person because the part of my job is that I want to say 60% of our clients come from outside of the state of California, come from outside of Los Angeles. I couldn't fathom being a trans man from Wisconsin with HIV. Who the fuck is he talking to about what's going on with him? Like he has no one. So, being seen and being open. I used to not tell people I was HIV positive. It just kind of used to be this like, I'm gay, I'm an addict in recovery, I'm an alcoholic. Like those things I was fine with, but like being HIV positive, yeah. And so you don't want to have sex? Okay, well, child, that's your loss. You know, I never thought about it, but like I guess I do. I have had lots of experiences where people have told me that they had never talked to someone who was HIV positive before. And that blows my mind because I live with me every day and my circle is very small and it's filled with positive and negative people and prepsters and all of that shit. But I'm very fortunate. I think we're very fortunate to live in Los Angeles, to be from Los Angeles, where there's stigma, but it's not the stigma of the Midwest. It's not the stigma of the South. I couldn't fathom how uncomfortable it must be to get that call or that email or the doctor telling you like, hey, you're HIV positive, and then not having kind of whole centers, the LGBT center, the APLAs, the what's the other one? AHF, like we have all this stuff and it's on the same block for the most part. Like to have these places to go where everyone is kind of on the same page. I think we're very fortunate to live here in Los Angeles. It's a great city. There's lots of traffic. The rent is too high, but I think when I went to treatment the first time and it was made aware to me how irresponsible I had been with my sexual conduct and the damage that I was causing other people.
Mm.
And the reason why I was being so reckless was because I had so much shame around being HIV positive. And it took a lesbian white lady who had lived through the AIDS epidemic and buried hundreds of people to tell me that there was nothing wrong with me. And I didn't like this lady. And she didn't like me, But no one had ever told me that I was okay. Or maybe someone had, but it clicked in my head that like until you become okay with this, you are a danger. You're hurting people. You're doing to people what that man did to you. You need to do some work on this shit. I think it was there in that house that when it was made aware to me, the wreckage that I was causing was fueled by the shame that I had blocked down from when I was 19 years old. All that I needed or all that could have started this ball was like, yes, you have this thing. You are not this thing. If you're HIV positive, you're HIV negative, there's nothing different about you. It's like having freckles or green eyes or a white mama. Like it just is what it is. Um, Find a community, and a community doesn't need to be a large group of people. Find you 2 or 3 good Judys that you can be honest and transparent about. And have some grace with yourself. There's going to be days where you feel fine. And then there's going to be moments or days where you just feel like the worst thing. Pick up the phone and say, I don't like myself today, to someone that really, really rocks with you, and get tested. All of these stories about, oh, I don't want to be one of those girls. Okay. You could not do that, or you could put yourself at risk. If it is that you want to go out and take loads for the weekend, get on PrEP. There are ways that you can do that. Also, look at why you want to take loads for the weekend. But protect yourself. There's too much science. There's too much information. The younger kids have access to all of it. There's TikTok threads. There's Reddit. There's this. There's that. Like, ask questions. Ask questions and take action. There's no point in you asking, oh, what should I do? What should I do? What should I do? And then you don't do shit about it. Find your local doctor. If it is that you live in a state or a city where you don't have access to that, get online. You can find doctors online for anything. Find someone who is going to help you to protect yourself. Because it doesn't have to be a big thing. You don't have to live in shame around having HIV. You don't have to live in fear of getting it. You get to live your life, but also take a look at your sexual behaviors and what's really behind it. Like, do what makes you happy. And if you don't know what makes you happy, take a breath. Because I found that I did a lot of things trying to put on this front so that people would like me. I don't know where any of those fucking people are today. I have no idea. All these people I was trying to impress with all of my sexual exploits. And oh, yes, I did him and he did me. And I don't know where none of those people are today. It was that search. And I believe in having to try things out. Try it out. But if you don't like it, be honest with yourself. If you don't like being tied up and spat on, that's okay. Seek information, take action.
Peppermint. We did another one.
Huh?
We did another one. I'm so grateful that we're doing this podcast.
Yeah, wait, hold up. That was Robert Evans. Y'all can find Rob at Rob B Sway 86. Please follow and give a look and follow, and let Rob know how much you enjoyed listening to this episode and to Rob's story in particular. Yeah.
And my uncle is not on. Well, my uncle's on Facebook. I don't know if y'all want to
that
find
feels
Uncle
kind of
Steve on
intimate.
Facebook. Right. Uncle Steve does not have a social media, and I don't think Glen Hill has social media either. So give all your love, give all of your
To
love
Robert
to
Evans.
Robert Evans.
And then tell Robert, you want to confuse Robert, tell Robert how much you love Uncle Steve.
Exactly. And Robert was like, "Who's Uncle Steve?" Um, well, Pep, thank you for chatting with me again about
Yeah, well,
another
thank you for
another
chatting with
topic here on
me.
our home.
I'm here every week, so I'm here to chat. And I'm so sorry that I had so much to say
That is the whole thing.
about it for about. I'm not sorry that I had a lot to say. I'm sorry that I hope it was useful. And I do want to remind people again to go watch, Endgame AIDS in Black America, because it really does. It's a nice snapshot for at the intersection of events between being out and queer as a Black queer person in the United States, AIDS and HIV in the United States, and also the crack epidemic in the United States, the war on drugs in the United States was all happening. It's all the same conversion, and then also the implementation of the plan to ship Black folks into the prison industrial complex was a big part of. There's the connection between that crack, cocaine in the communities, AIDS and HIV, and being queer and out slash closeted. This was a perfect storm of that contributed to the numbers, I believe, of not only HIV infections in the United States in Black communities, but also in terms of the prison population and why it's so part of why it's so disproportionately Black. Although we represent a smaller fraction of the population, and so please watch Endgame. It's an amazing thing. And yeah, well, let's wrap it out. Special thanks to our production team, executive producer Tracy Marquez, senior producer Charlene Westbrook, producer Corey Nixon, and post-producer Amelia Rittaler. Music by LaFemme Bear. Thank you so much, everybody, for listening.